Good morning. I'm so happy that you're all here. Well, we're going to launch the day with an introduction by the Deputy Director of ARPA-H, Susan Maneris. She's been in a service leadership role in the government for nearly 2 decades, and her roles have spanned innovation, health security, and biosecurity. She was the founder of the Health Resources and Services Administration Center for Innovation. She served at the White House in 2 roles, including as Assistant Director for the National Health Security and International Affairs in the Office of Science, Technology, and Policy. And she was also the Director of Medical Preparedness Policy on the National Security Council. Before that, she served in leadership positions in ARPA in ARPA positions for the U.S. Department of Homeland Security and also Human Health Services. And she also has deep expertise in the technologies that we'll be developing for Breathe. So she has experience working on the development of air biosurveillance systems and was a real thought partner in developing this program. So with that, I'll let Susan take it away.
Thanks, Jessica. I am so sorry not to be there in person. Jessica knows how excited I am for this program, and I'm not going to steal her amazing thunder when she goes into the depth of the activities associated with this program. But as she mentioned, this is an area that I have been deeply passionate about for many years. And when we were fortunate enough to have Jessica come join us, and she brought this to us, I was just over the moon. And I think it's going to be a phenomenal initiative that she is helming. But before we turn it over to Jessica, for those of you who are just getting to know ARPA-H and our organization and our work, I just wanted to give just a few moments of overview about ARPA-H and its mission for greater context. And then, like I said, I'm going to turn it over to Jessica. So let's go to the next slide. Our mission is to accelerate better health outcomes for everyone across the entirety of the health ecosystem, not in a predefined or preordained, we will focus on this disease or this particular set of individuals within the health ecosystem. Our remit, our mandate is the entirety of the health ecosystems and ensuring that we are driving towards better health outcomes for everyone in that health ecosystem. We are super fortunate within ARPA-H is that we have the best of the ARPA model that is accelerated through some key authorities that we have been granted by Congress. The first thing to remember is that we function like a business, quickly, nimbly, and decisively. So we don't give out grants. We do most of our work through other transactions, cooperative agreements. And once we've identified a problem and we want to move forward with addressing the problem, as Jessica will describe to you, we move with a sense of urgency and purpose and try to get resources out to the performer community as quickly as possible and hold those performers accountable to help us drive towards results. So just a few little elements about us. The first is we're a funding agency. We have no intramural labs. We don't do any of the work internally. All of our money goes out to the performer community. We are an independent component of HHS. We are not an institute of NIH, and we have a direct reporting responsibility to HHS. We are disease agnostic. So as I said, we don't have a preordained or predefined portfolio. What we have are these brilliant program managers like Jessica who come join us with a laser focus on a problem that they seek to solve. And then we seek performers who will help us drive towards those addressing that problems. We have an ability to work with FDA in a unique way where we can actually reimburse FDA to support some of the innovation that they need to accelerate their regulatory oversight responsibilities. And it's a partnership that we are still growing and fostering, and we look forward to continued work with them. And of course, our appropriations is dependent of ARPA-H. And we have been provided over the past several years between $1 billion and $1.5 billion each fiscal year, and we're super excited about continuing that trend. As I said, we are very lean. We are very nimble management structure. There are not a lot of bureaucrats here. We're a very thin layer of decision-making and program managers. We cascade a great deal of that decision-making onto them once they've been approved through the director's office to enable their programs. And of course, the director reports directly to the HHS secretary. The program managers are term limited. So Jessica is here for 3 years, possibly up to 6 years. But what that drives her and all the program managers like her is that every 2 weeks that go by is 1% of their time, and they need to drive as quickly and as urgently as possible to ensure that the big problem they're trying to solve can be solved during their tenure. And we have flexibility in hiring, so we can recruit at all levels that are competitive with industry. And we, as I said, a lot of bottom-up decision-making. So program managers like Jessica have the opportunity, once they have defined their problem, they've been given approval to run their programs, Jessica, the other program managers, they have the ability, the autonomy to make decisions quickly. They function essentially like a CEO of an organization. And we are a very much problem-focused organization. And as I said, it's accelerating across the entirety of the health ecosystem. And we recognize that a $4.5 trillion health ecosystem is very complicated, and it has many stakeholder groups. So we have our federal partners, NIH, FDA, CMS, and others. We have private investors, NGOs, industry. We have academia, patient groups, healthcare providers, and of course, the American public. And so we recognize we need to work with each one of these stakeholder groups, whether they're customers, performers, or partners, to ensure that we operate with openness, transparency, and effectiveness to ensure that we are accelerating those health outcomes for everyone. We have 4 main mission focus areas. We have the Health Science Futures Group, which is expanding what's technically possible. This is the over-the-horizon type. What is the next internet, or what is the next mRNA vaccine? What are the things that right now we could spark an innovation that leads to transformational change 10 years down the road? We have Scalable Solutions, which is looking at how do we take things that have been proven out to work in a very small or limited way and expand them so that everyone who has the potential to benefit has an equitable opportunity to benefit from those innovations. The Proactive Health Organization is working to keep people from becoming patients. So how do we upstream, even before clinical care interventions in a clinical care setting like a hospital, we can actually improve the health of all Americans so that we minimize the potential risk of becoming patients or having extensive morbidity and mortality associated with any type of a particular condition. We have Resilient Systems, which is building integrated healthcare systems. We know that we have a fragile healthcare system that is often strained, whether it's on an individual infrastructure level or whether it's nationally and systemic. And so the Resilient System Office is looking at how do we actually develop the capabilities to minimize disruptions and strengthen the overall resilience of the healthcare system. And then we have a group, our Project Accelerator and Transition Innovation Office. Their job is to come behind all of these 4 mission focus areas and ensure that the products and the capabilities that are being resourced by the 4 mission offices are actually able to, at some point, depending on where they are in their development cycle, reach the customers, which are the patients, payers, providers, the American public. And so their job is to accelerate the actual transition, the commercialization of the products or the capabilities that are coming out of the mission offices. In our first year of operations, we have been able to launch a number of incredible programs that we're so proud of. I'm not going to go into extensive detail about all of them. They're on our website, but what I would encourage you to do is take a look, and it gives you a sense of how we are pushing across the entirety of the health ecosystems and the types of big bets that we're taking through our program managers to address those challenges. Just a few examples. Our Nitro program was the first one that we launched, and it's an osteoarthritis program with, the idea of what if we could make our joints heal themselves? What if you could take a single shot to an osteoarthritic joint and it would heal itself within 1 to 2 months, and you would never have to have surgery, and you would have alleviation of the pain associated with osteoarthritis. DigiHeals is a program which is what if we could actually strengthen the national digital health infrastructure and protect against cyber attacks. We know that this is an increasing vulnerability across the United States on small rural health clinics or very large health systems or very well-resourced health payer systems. what can we do within ARPA-H to be on the cutting edge of technology to create scalable, cost-effective cyber resilience tools and get them out to all who would benefit. The BREATHE program is going to be discussed today, so I'm not going to go into details, but essentially it's what if indoor air was always safe and healthy, which we know is such a critical issue, and we're super excited to be able to lend our resources and activities associated with it. THEA is a program that what if we could restore vision to those who are blind using whole eye transplantation and reattachment of the optic nerve and total functionality, so that an individual who is blind could get an eye transplantation and not only have that organ be viable, but have the brain be able to once again help the person see. And the last one I'll talk about is paradigm, is what if we could develop advanced hospital level care to everyone in rural America? And that is taking mobile health units that are not just the current state of the art for mobile clinics, but actually something that really takes that hospital level technical care into the rural America, but in a cost effective and sustainable way to really improve the healthcare in rural America, when we know that year over year it's getting more challenging to bring that type of care to rural America. So the ones on the previous slide were programs that were driven by program managers who came to us, like Jessica, and had a great idea and really wanted to solve a problem. The project portfolio, this is where performers have initiated really innovative ideas that they want ARPA-H to fund through our open call for innovation proposals. So these all came from our open BAA. I'm running a little bit short on time, so I'm not going to go into the details, but this again will give you sort of the breadth and scope and depth of the types of things that we will fund off of the open call for innovation. Right now, each one of our mission offices that I mentioned have their own call for proposals, and all performers should really think about, where is your program best, or where's your project idea best aligned, and we are very much encouraging the submission of those proposals to that open call, and you can find information on our website. We do things in not just from the program side, but the project side, but we also are thinking about other ways to inspire innovation. We just launched our ARPA-H Sprint for Women's Health. We're super excited that we're committing $100 million to galvanize the innovator, investor, and research and patient advocate communities to ensure that the area of unmet need for women's health can be addressed through some of our project activities. And we're hopeful that we can fund some really amazing ideas this fiscal year. So more to follow on that. And then we also launched a grand challenge with DARPA on the cyber resiliency side. And so we'll be at DEF CON now this year and next year, challenging the sort of the cyber community to come up with novel AI tools and capabilities to find and fix vulnerabilities in software and in critical infrastructure. So we're excited to be part of that grand challenge. I already talked a little bit about the program manager flywheel. Next slide. And the program lifecycle. So as I said, we have an expedited approach. So we go from designing programs, building our performer teams, ensuring that we have execution and measurability so that the resources are optimized for milestone-based payments, and make sure that we're driving the performers towards our desired outcomes, and then certainly pivoting resources when we need them. We are a learning organization, so we want to make sure that as we understand what is working or what our limitations or challenges, that we're feeding that back into the organization. And then ultimately we want to commercialize and transition our capabilities into the stakeholder community. And this is a sort of an art image that we use to continue to inspire ourselves. This is over in an art gallery here in DC, and this still gives me goosebumps. We first brought this into the organization within the 3 months of our director, Dr. Wegerson, joining us. And every month that goes by, we are now in a unimaginable future. If we would have asked ourselves, would we be here a month ago or 6 months ago or a year ago? And the speed with which our organization has been able to stand up and put forward these amazing programs and starting to really shape the health ecosystem. We're so excited about it, and we're so excited for the trajectory that ARPA-H will continue on. And with that, I just want to thank you again all for participating in this Proposers Day. I'm super excited for what's going to come out of the Breathe program, and I'm going to turn it over to Jessica to lead you through the specific details. But before she does that, or while she's walking up to the podium, I just want to give you some background on Jessica. She herself is absolutely brilliant. So she joined ARPA-H in October of 2023 from Philogen, which is a San Francisco-based microbiome analytics startup, where she served both as the founding CTO and CEO. And so she's just a representative of the incredible caliber of program managers that we are able to have on board with us that are driving us towards success. Prior to that, she was a professor of biology at the University of Oregon, where she co-founded and directed the Biology and Built Environment Center. Jessica is an expert in the field of healthy building design with more than 2 decades of experience in scientific research, biotech, innovation, and commercial application. She had played a pivotal role during the COVID-19 pandemic, looking at novel methods for efficiently monitoring airborne pathogens in large office buildings. And she has received numerous awards for her career. And honestly, she is one of my favorite program managers because she has boundless energy. And I absolutely know that the confidence that we have in her, that this incredibly hard problem that she seeks to solve is in the best hands. And I cannot wait to get this off the ground and to start making progress in that. So with that, I'm going to turn over to Dr. Jessica Green to lead you through the next discussion.
Thank you for that really warm intro and description of ARPA-H. So Bridget, who's in the front row, just shared with me that the quote that we saw, this present moment used to be the unimaginable future, was from Stuart Brand, a conservation biologist. And that's how I feel right now. I just can't believe we're at this point in history where indoor air and solving problems around indoor air is on par with healing joints, with restoring vision, and with bioprinting organs. So I'm grateful for everybody who is here, and particularly the people who have spent decades working on these problems. So with that, what I'm going to do is I'm going to give an overview of the program. There will be time for sidebars later and also virtually. And after I go through this program, we're going to have 2 visionaries, Carl Bass and Larry Brilliant, who represent the epidemiology expertise and built environment expertise, will give a fireside chat. And that's going to start at 10, and then we're going to have a short coffee break. So with that, today, when you walk into a building, or if you're in a room like this, it's a liability to our health, and it really doesn't need to be that way. 50 years ago, and again, I'm kind of preaching to the choir right now, I think, for most of the people that are here, we were able to improve outdoor air quality, and with tremendous success. So we were able to understand the relationship between, as an example, particulate matter loads and mortality and morbidity. And we learned that by regulating outdoor air quality, we were able to not only save lives, but decrease the number of work days lost, the number of days lost in school. And there was a estimated tremendous benefit to these investing in outdoor air quality, which exceeded the cost by a factor of 30 to 1. But unlike food and water, we don't get to choose the air that we breathe. So we don't always get to choose the food and water that we eat, but we have a lot more autonomy in that than what we're breathing in the indoor environment, as an example right now. And this puts an unnecessary burden on Americans, but everyone on the planet. And I'm just going to show a few slides here that outline, I know this is really hard to see, but at a very high level, when I was kind of pitching ARPA-H on why this was important, there's 3 buckets of why it's really important to tackle indoor air quality challenges. And the first is At least one group of scientists estimated that during COVID, we were 18 times more likely to get one another sick in a building than outside of a building. And we know that lower respiratory infections is one of the eighth leading causes of disease in the United States. And we also know that there's a tremendous economic burden due to poor indoor air quality. So there's been a lot of estimates of this, but it's a very significant problem. And then finally, when you consider what's going to be happening in the future with climate change and the increased prevalence of pathogens, the increased prevalence of airborne allergens, and increased population, these problems are only going to be getting more amplified through time. So now is the time to really develop tools to allow us to manage indoor air. So today, indoor air technologies, they're really not optimized for health or speed or scale. So if you look on the left here, the current state of technologies is we do have the ability to sense in real time at very low costs, particulate matter and CO2 as an example, which is really important and something that I think we should be doing at all buildings today. However, we don't have standardized measurements for air biology. And if we want to understand what's in indoor air today, it requires manual intervention. So back when I was a professor, we would use SKC button samplers. Mark Hernandez actually taught me how to do that as a professor, where we would, pull aerosols over a filter, and then we would send them to a lab or take them to the lab and run them through molecular diagnostic processes. And you can buy tools today to do that. But everything that's available today, there's really time lag results, and it's too late to respond to threats. So if you look on the right here, the BREATHE program, the vision is to develop sensors that can detect a wide range of viruses, bacteria, and fungi. And we can use these systems for routine assessment of indoor air quality and risks. And finally, what we want to see are smart and energy efficient interventions that are tailored for health. The way that ARPA-H kind of structures their programs is by technical area. And there's different ways to do this, but something that is really important for this program is that experts in the 3 technical areas that are identified in this program come together at the very beginning. And I'm going to go through these technical areas, and then I'll explain to you why I think it's so important that expertise in these different technical areas join forces from the outset. So the first technical area is inventing an autonomous sensor. And we want sensors that, again, require no human intervention, and sensors that by the end of the program are able to, or I guess it would be the middle of the program, able to detect 25 different targets. And those targets will be up to the performers, and proof of concept of being able to identify in air 100 different targets. And we also want to make sure that these sensors are focused on a broad swath of microorganisms or microbial traits. So we want to make sure that these sensors can detect viruses and bacteria, and then performers can choose what the third bucket is. So the third bucket can be fungi or can be allergens, however performers decide to define allergens. The second technical area is the development of risk assessment software. So what the vision is that once we have the ability to measure what is in air, and imagine a world where we had in buildings across the country sensors that were giving us reliable information about the loads of viruses, bacteria, and fungi or allergens. We then can, and if we had really high quality information about human health outcomes in those buildings, we can then begin to understand dose response in an evidence-based or data-informed ways. And so that's the goal of the second technical area, is where we want something akin to the outdoor air quality index, but formulated for indoor environments. And then the third technical area is developing basically interventions, or not developing interventions, but demonstrating that in the built environment, if it's possible to detect what's present, to assess if there's a risk, that then there's a way to take action and mitigate disease risk and health risk. And what we're looking for, and we're going to go through in more detail the different metrics, is the ability for in the built environment to respond to what we know from the software, I've learned from the software. And the response, it's really up to the performers who come to the table to decide what they want those interventions to be. Now, I know that there is a lot of funding opportunities and new interventions, which I'm an advocate for, like far UVC light. That is not what Breathe is doing. What we want to do for Breathe as a starting point is start with existing interventions and demonstrate that this closed loop system works. And then finally, once we have the ability to sense what's in the air and assess if it's a problem, we're going to conduct a nationwide efficacy trial. So we're going to deploy these systems in buildings across the country. And what we want to see by the end of the program is proof of concept that there's at least a 25% reduction in respiratory illness or disease as defined by the performers at a 10% return on investment. And what do I mean by 10% return on investment? The calculus for that, we really want to show that there's low operating costs for the user to implement these systems. But as a part of calculating that return on investment, it can include not only the cost of using these systems and the benefits from my financial perspective on from a financial perspective, also the benefits when taking into account impacts like lives saved, as an example. So both types of benefits can be incorporated into this return on investment calculation. So this is really reiterating what I already said. If you look at the upper right-hand corner of this slide, we're going to leave it up to the performers to decide what type of built environment do you want to run your program in. And we want our performers to select one type of built environment. So we don't want performers to be looking at schools and hospitals and homes. We want performers to build a case for a built environment type that is going to be the best for having this outcome at the end of the program where we see that these systems are effective. We want our performers to have facilities that are in 3 different climate zones so that we can see repeatability in the efficacy of these systems. And with regards to the data infrastructure, what we're envisioning is that within a performer group, data obviously will be shared because that's going to be a requirement for developing the risk analytics software as an example. And we do see the potential for shared external data. So as an example, if entities kind of come to the table and say, we have access to wastewater surveillance data in, these cities or these zip codes, we're optimistic that there will be some data sets that are either generated by the, I'm not going to state which entities, but we're optimistic that some entities will come forward and provide some data to our performers to help bolster the program. All right, and then at the bottom of this slide, I'm going to go through, this gives a little bit more information about how the program is structured. And I'm going to say it in words. And then I know that I'm going to show some graphs that are going to be very impossible, basically, to read. But all of the information that is in this slide deck is in the draft solicitation right now that you can take a look at in detail. So the first point at the bottom of this slide is that we are including as a part of the program at the very outset, funding for performers to collect baseline data from their facilities. And that baseline data, we're imagining, is going to be collecting occupant health outcome data from the outset, so that performers can have confidence that the facilities that they've selected, that there's a high enough incident rate of health outcomes that they're going to have statistical power to demonstrate that the efficacy of their systems. And also manually collecting bioaerosol data and other metadata from those facilities. And then in the middle of the program, phase 2, we're going to be having chamber testing of the sensors. And then in the final part of the program is where these technologies will be deployed out in the field. So going a little deeper on each technical area, the first technical area is focused on developing and validating cost-effective autonomous sensors. And if you look on the left here, state of the art, we have autonomous sensors for air chemistry. It's not complete. There's still a lot of work to do in that area, and I recognize that, and particulate matter. And again, there are off-the-shelf manual air biosensors, but what this program is going to be doing is creating autonomous nest-like air biology sensors that there's a whole universe of how these could be developed or invented. And I'm really looking forward to what performers come to the table with, but these sensors could invoke active sampling where there's a motor involved or some power. They could be passive samplers that are wearable devices. We're envisioning that these sensors will need to deploy methods for low biomass and autonomous molecular diagnostics. And possibilities include microfluidic enable systems. And then finally, there's going to need to be the capability of high multiplexing. So we know that we want to see 25 targets. And again, I recognize this is moonshot, but here we are, and we're going to get it done for the field deployments, and then proof of concept for 100-plex. And finally, possibilities include, but aren't limited to, nucleic acid or antigen detection. So the second technical area is really focused on risk analytics and understanding dose response for bioaerosols. The state of the art today, we've figured out how to do this for outdoor air. Today, you can look at your phone right now and get what is the air quality index for probably this block in Oakland, California. And what we're envisioning is that there's going to be something like this for indoor air. And I imagine it's going to be a similar analytics process to what we've done for outdoor air. And as an example, we know that we'll have the sensor data coming from this program. But we also envision that performers are going to be capturing all different types of metadata. So that metadata could include, and there will be funding for this, sensors, including sensors for particulate matter and CO2 and other air quality data. Obviously, building data. So how is what are the occupancy loads in the buildings that we're utilizing? A really critical part of this program is that health outcome data. And this is where the TA3 performers that I'm going to get to are going to come in. It's going to be important for performers to come to the table that have the ability to provide information about the health outcome of the people in their buildings. There's all different ways that this can be tackled, and it's going to be and how this data can be accessed, and it's going to be up to the performers to figure out how they're going to do that. And then finally, external data like outdoor air quality data, wastewater surveillance data, mobility data. I think that there will be the more data that's possible to scrape for this program. Another potential outcome is we may learn that there are proxies that don't require, as an example, using biosensors in every building on the planet to understand whether or not the air quality or environmental quality in a built environment is high or low. However, so that would be an ideal situation if proxies we learn are highly effective. And at the end of the day, we'll still have access to technologies for quantifying airborne biologics that will be in certain applications, which will be incredibly valuable in many different dimensions and aspects beyond the possibility of having Nest-like biosensors in every building on the planet. And what we're envisioning is that if you look on the right here, it should be feasible to then identify, let's just take a building like this. Is there a high risk in this room of, somebody getting influenza? And is that a different risk relative to the first floor of that building? And then can we, in an energy effective way, treat the air up here and possibly not be treating the air downstairs? So I hope that's clear. And here's the third technical area. So this is really where entities that are able to come to the table with access to buildings and health outcomes in those buildings are going to come to play. So the state of art today is that most buildings, I know that there's some exceptions, and buildings that have already deployed, as an example, CO2 sensing in their systems, bravo, they're like really ahead of the curve. But most buildings are designed for human comfort and for minimizing operational costs and energy use. And what we're envisioning down here at the bottom in the future is that buildings are equally weighting our comfort with our health when for occupants in the built environment. And I think that there's many different ways that this could be approached. Again, one way that this could be approached is through demand control ventilation. There's very myriad of different ways of ventilating spaces and an intervention modality that can be utilized. But it could also include other intervention modes or combinations of intervention modes that are effective. So on the other side of the spectrum, if in some settings, masking is an actionable intervention that performers want to deploy, that is also makes a lot of sense in some settings and in some scenarios. So really we are offering or asking the performers to come to the table to really outline in advance what they think are going to be the most effective interventions, and also that hit that return on investment where the intervention isn't so disruptive or operationally expensive that we're not hitting that target, because ultimately we want these systems to be commercialized. That's the goal. All right, so here's the wall of text slide. I'm only going to make a couple of points on this slide. So the first point is that this is a 5-year program. The second point is that we have built here up front 6 months or 2 quarters that for performers who have been selected, you have some time to continue to ideate and refine your ideas, because we want to make sure that your whole plan for the next 4.5 years is like locked in and has been very well thought out, in that boots on the ground, you've been to the facilities, you understand how the interventions are going to work, et cetera. We also, I want to point out the importance of, you can see we've got these 3 technical areas. So proposals will not be considered unless there are performers in each of the 3 technical areas. The next thing that I want to highlight here, is What you can see here, so this is just showing kind of where this baseline data is being collected. So I just want to make sure that everybody knows that right out of the gate, data will be collected. And again, this will be manually or scraping the human health outcome data from those buildings so that the risk analytics models can begin to be developed. And this will also help inform the kind of the product requirements and parameters of the biosensor. And another key milestone that you can see here where this bright red line is validating the biosensor. So what we mean by that is this can be manual validation of the biosensor at this point. We're going to want to see that if you expose your sensor, it can be even just using a pipette or something, however you want to do that, to viruses or bacteria or fungi, that it's working. And then what you can see down here is at the 36-month mark, this is where the chamber studies are going to happen. So we're going to want to make sure that the biosensor prototypes are working before they get deployed in buildings. And then finally, you can see here that out here is when we're going to kind of have the first wave of field deployment of these newly invented systems. And we're giving everybody a year, or is that a year? We're giving everybody, 2 quarters to first make sure that systems are properly working once they're installed in maybe a few buildings or a smaller subset of buildings before these field trials happen at the end of the program. And I think that's it for this slide. All right, so again, these I'm not going to go through everything in each of these metrics tables. They are in the draft solicitation and will be in the full solicitation, but I'm just going to go through a few elements of this. So the first thing that I want you to look at is this left-hand column. That's really where we're defining what the metric is. And then the second thing that I want you to know is that for a lot of these, we have that the target is set at 6 months. And the reason for that is, as an example, the limit of detection or the cost of the sensor, it's really going to require our performers to be going back and forth across each technical area to narrow down what are the right product requirements. So we need to have performers to have a really strong idea when they propose of what they're going to be building and why it's a good idea to build it that way. And I just guarantee that after working together for 2 quarters, ideas are going to be refined. And that's the way it should work. And so we've baked that into the program to give you all time to get it right. The second thing, I'll just feature on give an example of how to read this table. So let's go to the multiplexing capability row in the middle. What we have here is, again, the capability by the end of the program is proof of concept for a 100-plex biosensor. But if you look from left to right, we want to get to 25% of that target, or a 25-plex biosensor, by the time we get to the chamber studies. And that's what's those prototypes, if they make it through the chamber study phase, those are the prototypes that will then be deployed in the field for the nationwide efficacy study. All right, on this next slide, these are some of the metrics for the risk assessment software. And again, we are giving our performers some time at the beginning of the program to really lock in how are we going to assess the performance of our models. And the last slide here, focus on technical area, focus on the building controls and system integration. What I want to feature here is this here. I already made the point on return on investment and how that return on investment can include both a quantitative value on the health impacts as well as a return on investment to the end user. But what I want to also emphasize in this slide is that TA3 really represents the end user. I mean, this is the voice of the customer, TA3. And so TA3 is going to really be, as an example, putting constraints on what does the cost of the system need to get down to that it actually scale in the marketplace? What are the user requirements for these systems? What are the most important respiratory diseases to be focused on in the application that we've chosen? So what I imagine is going to happen is that this performer is going to put radical constraints on how the sensors are going to be developed and the software. And then those teams are going to go back to this team and say, what you're asking for is impossible. And it's going to go around and around until, again, the goal is to, at the end of this program, have proof of concept that we can then continue to invest, or venture capitalists can continue to invest, or other capital can come into this program to get these systems to where they need to be in short order so that they begin to scale in the marketplace. Now, I wanted this slide came from that group patio that Susan was describing. You don't need to know all the acronyms right now at ARPA-H, but what you want to know is that, again, the real goal is that at the end of this 5-year program, that the solution is going to have a home. So it's either going to be absorbed by an established company, or maybe a startup that's already VC backed, that's ready to scale it. It may be the beginning of a totally new startup company. It may be adopted or kind of purchased by a government entity. And what's important for you all to know is, one, you should kind of have your eye or be thinking forward in 5 years, where is the home of these systems going to be now that ARPA-H has invested to de-risk the development of these technologies? And then also to know that we have a whole team at ARPA-H that is poised to help our performers with this. And if you remember when Susan showed that slide, she showed the 4 offices or mission offices within ARPA-H. And then she had this whole bucket of, there's a whole staff that is dedicated to working through in the very early stages from day one of helping performers be able to envision where these technologies are going and what they need to be doing in partnership with ARPA-H throughout the program to make sure that the technology has a home. All right. And this QR code here is where you can be utilizing on the lower left-hand side if you have any questions. And with regards to teaming, today is one way that we were hoping that people would meet each other and begin the teaming process. I recognize that there are the worlds that teams live in that would be contributing to these technical areas always don't overlap, or often don't overlap. And so we want to kind of go above and beyond to help folks meet each other in advance. There's also a website, a teaming website at ARPA-H that if you use this QR code, where you can go in and put who you are, how to contact you, what you have to offer for the program. And then I'm not 100% sure what it's going to look like, but I'm working with the ARPA-H team to facilitate at least one additional teaming opportunity, because I want teams to meet each other and performers to meet each other so that really strong abstracts and then proposals come in. Are our special guests on? Oh, there they are. Hi. Hey. All right, I'm going to introduce you guys.
Great.
And I thought you all might like to know that they got an agenda different than yours, where their bios were flipped, which I really like that concept. So first I want
a promotion.
So I'm thrilled to have both Carl and Larry join us. I'll introduce Larry first, Dr. Larry Brilliant. So you may recognize him as CNN's resident COVID expert. but he's the most famous for leading the World Health Organization team that eradicated smallpox. He's currently the CEO of Evity.ai and the CEO of Pan Defense Advisory, and one of his colleagues, Lisa, is here today. He's previously a VP at Google. He was the founding head of Google.org. He's a former CEO of the Skoll Global Threats Fund, and he co-founded the SIVA Foundation, which restored sight to over 10 million blind people in 2 different countries. And I highly recommend his book, Sometimes Brilliant, about his personal journey living in an ashram in India and studying under Guru Neem Karoli Baba. And I'd also like to introduce Carl Bass. He's the former president and chief executive officer of Autodesk. I was really fortunate to have Carl. He was on the board of a company that I co-founded. And Carl, I learned a lot about you getting this bio ready. During his 24 tenure at Autodesk, he had more executive roles than I've ever heard of anybody having at one company. So not only was he the CEO, and I think that was for 11 years, but he was also the CFO, the COO, the CTO, and the Chief Strategy Officer. Did I get that right, Carl? Okay.
Yes, you did.
All right. And before Autodesk, he was a co-founder of Ithaca Software, Buzzsaw, and Flying Moose. He really is a legend in the startup world here in the San Francisco Bay Area. He mentors entrepreneurs like myself. He's a frequent board member of multiple hardware and software companies from startup to scale. And when he's not mentoring entrepreneurs, he can be found in his shop in Berkeley, near the Berkeley Bowl, making everything from robots to boats, furnitures, and electric cars. So the first question, I had a chance to connect with these guys last week. The first question that I wanted to set them off on was answering the question, given that Bree's vision is a future with healthy indoor air for everyone, why is this important, and particularly why now?
Well, it's not only important because we need to put ahead of the roaring train that a novel pathogen epidemic or bioterrorist attack could be. We need to put speed bumps, traps in front of it. And we know that wastewater and surveillance in wastewater is a trap like that. But we don't have a lot of other places to really do surveillance, to know what's coming. And for the first time in history, we have the tools to quantify and detect airborne pathogens, allergens, and toxins. Our biosensors can be coupled with existing particulate matter and chemistry sensors. And we increasingly have agnostic early diagnostic tests. And by agnostic, I mean with a PCR or a molecular or an antigen test, you have to first know what you're looking for. You have to have the viral genome. You have to be able to create the tool that lets you find it. Increasingly, we're able to find everything and know what all the pathogens are. If you couple that with air and you put that together with real-world environmental sensors at scale, now we have the ability to trigger interventions before it's too late. And because we have those abilities, it now makes it much more worthwhile to put in place the airborne surveillance that will give us that data. If we didn't know what to do with it or couldn't do something about it, then there might be an argument, why look for it? But that's no longer the case now. So this is a great moment for your program, Jessica.
Carl?
Yeah, so I would just add, we spend a remarkable amount of time inside of buildings. And if we really want to change our health, as Larry said, make a trap for some of the pathogens or allergens, this is a perfect opportunity. We can really change our health. And it's surprising to me in this day and age, with the availability of testing and sensors and ability to communicate in real time, that for the most part, our homes aren't that different. You know, we have CO2 detectors, carbon monoxide detectors, we have smoke detectors, and we have thermostats. But most buildings don't have much more than that. And in this day and age, they really can. I'd also say while these threats that Jessica and Larry talk about are becoming more common, we have competing interests in the development of buildings. We see, because of climate change and the desire for buildings to be more energy efficient, we are getting less circulation of air. In some ways, we're creating less healthy business buildings. And I think we have this opportunity to simultaneously achieve healthy indoor air and much more energy efficient buildings. And we need solutions to this problem. And we need to increase the awareness for everybody that the air that they breathe inside buildings may actually be worse than the air they're breathing outside.
Can I just give two examples to support what Carl just said?
Please do.
If you think back to the outbreak of Legionnaire's disease in Philadelphia,
yeah.
The air was pathogenic. The air, because the Legionnaire bacillus survived in the HVAC system, the HVAC system actually functioned as a bacteria distributor. And one other example, a lot more dangerous, I think. I've written a lot about the last cases of smallpox. It's very emotional for me, and it's very inspiring to the world to eradicate a disease. And we all focus on that last case in Bangladesh or the last case of variola minor in Africa. But that wasn't the last death from smallpox. The last death from smallpox was in a room above a lab where somehow smallpox, which was being studied in an approved laboratory, WHO approved laboratory, entered into the air conditioning system, and the viral particles were distributed in the floor above it, not part of the lab. So the air, again, was an adjunctive carrier for smallpox, and it killed the last person who died of smallpox. So I think that as we look at right now, H5N1, where we are literally on the precipice of uncertainty, H5N1, which is being called moo flu because it's in cows, it's also in birds. It is bird flu. However, bird flu is not bird flu. This is an epizootic, meaning it's in every animal. If it gets into pigs, or if it gets into civet cats or mink or ferrets, which are all animals that look so much like humans that they're mixing vehicles, reassortment vehicles, we need to know about that right away. And being able to monitor the air around them, they're often outside, but they're frequently inside, especially mink, then I think that will help us understand where the virus of H5N1 is before it mutates into something which is human to human transmissible. So all these reasons make it important to think of inborn air, not only making life healthy for everybody indoors, but also as a trap, as you said, Carl.
So, Carl, something that we've talked about before is, you've brought up why have not these capabilities kind of come to the market to date, and can you share with people both reasons that you feel optimistic that the time is now for bringing breathe technologies to market, and also any kind of words of advice for potential performers that are kind of just about to embark on this journey? I mean, I feel right now that we're at this incredible point of history. I said this before you two logged on, that here we are at Breathe Proposers Day, where we're tackling indoor air quality challenges, and that's considered on par at ARPA-H to curing our joints, or bio-designing or 3D printing organs, or curing cancer. And so it would be fantastic if you could share your insights as to what performers should be thinking about, because really this journey has just begun, and there's going to be a lot of hard work to get these solutions to market.
Yeah, so the most, in my career of looking at successful technology products, the thing that makes things really successful is when you can point to some point out in the future at which you combine technological capability with a latent need or desire. Those have always been the most successful, is somehow realizing this is a problem, going to become a bigger problem, and we have the technical capability. And if I look now, low cost microprocessors, low cost sensors, an awareness in the building industry that in many technological realms, it's been pretty stagnant. HVAC systems are only moderately different than they were 5 or 10 or 20 years ago. So I look and I say, there's a desire on the part of the industry. There's definitely the technological capability, and there's going to be growing demand from the increasing risk. So I see that as all good. Now, having tried and watched people selling things into the building industry over many decades, there are usually two drivers. One is just making things cheaper. And so there's lots of technological, or a lot of technologies that have been adopted because they lower the cost of construction or lower the cost of occupancy, the ongoing carrying costs. But I think beyond just lowering the costs, what helps is when there's really end user customer demand. And most real estate developers will only build things where they see it's purely capitalism and they want a better return, and they will build to what the market requires. And so 20 years ago, you saw very little effort to make buildings more energy efficient. The costs of energy efficiency weren't obvious who realized those gains. And so it went unattended. Then all of a sudden, companies that were occupying spaces, those of us who were renting or buying homes, became much more aware of it and demanded that our buildings be that. So right now, we're at this interesting time and we have these two competing needs about more energy efficiency and healthier air inside our buildings. And we need a more comprehensive approach to that. But the thing that I would say is, and why I love seeing DARPA get involved in this, is the idea of being able to bring the awareness that we now have technical solutions to these problems, and we should all want them in every one of the buildings that we occupy.
So something that makes ARPA-H kind of different from DARPA is DARPA.
Oh yes, I said DARPA. I meant DARPA.
Yeah, I know, but
sorry, Jess.
It's highly relevant though, because DARPA, the customer is, the Department of Defense, but at ARPA-H, the customer is all Americans, and I actually think every person on the planet if these solutions scale. And so on that front, Larry, do you have ideas based on what's happening with the climate, your understanding of the future of pandemics, how future events over the course of the next 5 or 10 years might really drive this user demand that Carl is describing that's so important for these solutions to be successful? And given how forgetful humans can be about what has happened in the past, and there can be fatigue, there's COVID fatigue as an example, and which is one of the reasons why the market, kind of lost opportunity in developing, lost an appetite for developing these types of systems. What do you foresee might happen in the near future with regards to how potential end users are going to be thinking about and motivated by indoor air quality?
Well, let me combine two things. First, I don't know if any of you saw the movie Contagion, but I did the science and I wrote the first proposal for that movie. And if you stayed until the end of it, you realize that epidemic, that pandemic, was really caused by the same things that caused climate change. It was clear cutting of the forests in which bats live, and then the bats flying to new territory, commingling with other bats, sharing viruses, as I'm pretty sure that that's what happened also with SARS-CoV-2. And then an infected bat chomped on an apple and dropped it, and a pig ate it. A pig, again, is that great mixing vehicle. And then Gwyneth Paltrow died, and that began it all. We are undoubtedly going to see more novel viruses. Humans are living in each other's territory. We now share the pathogen profile of all the animals in the world. And there are 300,000 animal viruses that we don't know anything about. And at least 2,000 of them are capable of infecting humans, going human to human and spreading an epidemic or potentially a pandemic. Pandemic will drive us towards the realization that we need to be more on alert. Having said that, if you couple that with the report last year that 30% of Americans said that they contracted a disease in a hospital or they suffered a physician's failure, and you ask yourself, what? Because you said, where will the demand come from? It's inconceivable to me that 5 years from now, every hospital will not be required by law and regulation to have sniffers, because to not be able to make the air in a hospital free of pathogens is one of them. What? How could you even believe that that would happen 5 years ago? And I'll add one more thing, because you've asked about climate change. So the company that I've just started, Evity, which sounds like equity and rhymes with longevity, we are trying to understand what are the components of the diseases that rob you of years of healthy life. What causes longevity to stop increasing? It's doubled over the last 100 years. Now it's flattened, plateaued. And health span, the years that you are healthy before you become sick and then die, can be anywhere between 1 decade and 3 decades. In much of the world, you are sick for 3 decades before you die. What are those causes? And then we're creating a calculator for everybody to be able to know what are the things that cause their loss of health span. And if you do the list of those, for everybody on this call, I'm sure you could name the first 4 or 5. You'd say, name atherosclerosis, whether it's heart attacks or strokes, and you'd add cancer and neurodegenerative disease. But you probably wouldn't add climate change, because climate change is probably number 14 or 15 on the hit parade. But it's moving up. And by the time our children reach an age where they need to start thinking about this, climate change may be number 7 or 8 of the leading causes of robbing you of years of healthy life. And by the time our grandchildren are of age, it will have risen up the hit parade, so it might be number 4 or 5. And that's because so many aspects of climate change are not understood when we think about what's the next pathogen, because we don't include mosquitoes. We don't include the fact that sea level rise doesn't just mean washing away your beautiful seashore. It means salt poisons freshwater lakes, creating brackish water, which the Aedes aegypti mosquito like, and they're the ones who carry yellow fever. By the way, in the Revolutionary War, we had yellow fever in Philadelphia. It's inconceivable to me we won't have yellow fever in Philadelphia again. But Zika, dengue, chikungunya, African sleeping sickness, West Nile, they're all carried by a mosquito that we don't see very much in the United States because we don't have much brackish water in warm temperatures. That's going to change. That's only one of about 20 of the knock-on effects of climate change that will force us to confront the fact that we are on a verge of an age of pandemics, not just one pandemic, but a series of epidemics and pandemics. And all of those diseases have to pass through closed indoor space. And so if we can't have it that we can understand the air in our airports, the air in our airplanes, on our trains, in our homes, in the hotels we stay in, then we're going to miss an opportunity to stop those diseases before they become out of control.
Thank you for that. So Carl, one more kind of follow-on question. You've been involved in, again, so many companies and seeing those companies from, inception to exit, and are familiar with kind of what happens that really transitions a potential product that people may not even know that they want it, but then they want it. And then there's kind of this shift in the market. I know I'm asking you to be a futurist, but do you do you have any kind of insights as to what might kind of be a tipping point for healthy buildings that might kind of translate into this market demand from a place where it's beginning, but it's still not, it needs to expand?
Well, I think the first thing, futurists are really no better than baseball players. I don't think even the great ones bat more than 300. So let's just start there. So there's like a 67% chance that I'm wrong in what I'm saying. But no, seriously, I think if anything good came out of the COVID pandemic, it's that people are way more aware of the risks. I think we're also way more aware of our ignorance. While they may have been healthy steps in the beginning, I mean, I, for one, am glad I'm no longer wiping my Amazon packages with alcohol. I couldn't play tennis because we had to wipe down the nets. I have no idea how that was going to be the carrier. But when you realize that that was, maybe the average of the state of knowledge about what was going on, it's really pretty pathetic in retrospect. So I think in some good way, it made us all aware, because many of us living in places like the United States are pretty immune to some of the diseases that are so rampant in other less developed parts of the world. And all of a sudden, this came into everybody's home and school and hospital, and it affected almost every family in the US. And while I'm not wishing for more, I think we've just raised the awareness to a place. And what I'm most interested in is, I love this thing when you can feel this need growing on the side, and Larry does a great job of explaining in detail why this is true. But, from my side, it appears that we have many of the pieces and parts to make all of indoor air much more healthy. And we have the components, they're affordable. It's a matter of getting the right products in the right places. Where do we detect it? How do we filter it? How do we notify people? What's the public policy in responding to these things? These are all interesting questions that I think many of the people who get involved in this program will have to solve. But I think the two main elements of it's a growing need, and there is a viable, or there will be viable technical solutions. We have all the building blocks to make things that will, if not solve, put a huge dent in this problem. And that's why I'm so optimistic about this. And those are usually the conditions for new companies to prosper. And I'm relatively indifferent whether it's great new companies that prosper, it's new technologies that go to the incumbents. I just want buildings to be healthier in the future. And whatever the best means is, given the economic structure of the industry, I'm relatively indifferent.
Thank you. So we just have a couple more minutes, and I thought what might be helpful to everybody who's kind of showed up for this event, whether you're virtual or you're here in person, is to just hear any words of advice that you have for entrepreneurs, because everybody involved in solving this massive problem of creating a future of healthy indoor air for everyone, it's going to take really a lot of strength and a lot of veracity and collaboration. And you've both been very successful all throughout your career of having a huge impact on people and the planet. So just in closing remarks, maybe we'll start with Larry, if you just have any advice for our this base of people on how to accomplish this moonshot, that would be great.
Well, I usually try to hide this from people, but I've been CEO of 2 public companies. I just don't want to get, I don't want to ruin my credentials. And about half a dozen venture-backed startups. And there's 100 different ways to fail, but there's one condition that you need to succeed, and that's surrounding yourself with great people. And if you're a leader, you have to surround yourself with people who are smarter than you. And you can persuade yourself that you're not really dumber than they are by getting people who are smarter than you in specific areas. But building your team it's the absolute number one most important thing. My father used to say to me, there's 2 kinds of deals and 2 kinds of people. There are good people and bad people, and good deals and bad deals. And when I would say to him, well, which would you choose? He said, well, every bad deal with good people will turn out ultimately to be a good deal. And every good deal with bad people will inevitably turn out to be a bad deal. So that's my bit of advice. Surround yourself by good people, smart people, hard workers who share your vision, and you'll be able to survive the inevitable bumps.
Thank you. And Carl, you get to have the closing words.
Sure. I would echo Larry's comments. It was the first thought that came to mind. It's all about great, smart people who do all the things that you don't do well. Find people who do all of them better. But I'll add to that one thing that surprised me. You read off that long list of C kind of jobs I had. But when I became CEO of Autodesk, 2 things happened. The first thing was I really became much funnier and much smarter. And and I think there's a joke in there, but the flip side of that is as you start these ventures, make sure you have great people who will tell you the truth, who will argue with you, who will confront the facts. You're solving both hard technical problems, hard financial issues. Building a business is difficult, and having great people who will really talk to you. But that's all part of the most important lesson I learned when I became CEO. I somehow thought that the job was all about making big decisions, important decisions, and that the culture was a byproduct of all of that. And when after 12, 13, 14 years of being CEO, when I left, it was 180 degrees reversed. I realized that the most important thing you can do as the leader is build the culture of the company, and then great products will result from that. So it's not enough. It's necessary, but not sufficient to have great people, but you have to build a culture where it's open. You can have honest debate where you're all, kind of playing for the name on the front of the jersey instead of the name on the back of the jersey. All of those are really, really important if you want to accomplish things as difficult and as important as what's going on in this program.
Thank you so much. And that really echoes my view on this program. I really want to be in partnership with a performer base that's gonna, with the eye on, again, solving this massive challenge, and with performers that are gonna tell me the truth and tell me what they think, and provide input, not only to me and ARPA-H, but to their fellow performers. So thank you both so much for contributing to this conversation. And thank you for being such an inspiration to me and others. Appreciate it. Bye.
Thank you.
Thanks, Jessica.
Hi, my name is Marissa Maloney. I am one of the agreements officers within the Business Innovation Division, known as BID, within ARPA-H. BID is ARPA-H's internal contracting shop. I primarily work with the Resilient System Office program managers, which is where the BREATHE program resides. I know a lot of you or online or maybe in the room today may not be familiar with working with the federal government or what my role is in this process or what an agreement officer does. So I'm just going to quickly walk you through it so you kind of understand my role in this process. So agreement officers work with ARPA-H PMs on the acquisition strategy and approach as they start to build their program. We also then aid in the development of the solicitation, approaching things from a business and acquisition standpoint. And then during the solution summary and the proposal process up through evaluation and selection. And then once those select letters have been sent out to notify potential performers that they've been selected, I am the person, the agreement officer is the person that then works with all of the performers to negotiate those terms and conditions that you will see in your resulting agreement. We also work with you on negotiating the price in the resulting agreement. Once performance has started and you have that awarded agreement, we're also that primary point of contact between the program manager and the performer. If there's any needed changes to your scope of work or to your price, you would get with your agreement officer and we would start that negotiation process again. I bring this up because only the government agreement officer can obligate the government. We're the ones that are signing those agreements. If money needs to be added to your agreement, that is something that I do. Again, like I said, I know there's people online in the audience who are new to the government, working with the government, or you may be also familiar with government contracts, but not familiar with ARPA-H or with other transaction agreements. So my presentation today is just going to walk you through a high-level overview of the BREATHE solicitation. I'm going to talk about the process timelines, pertinent details that I really want everyone to pay attention to, and then what to expect moving forward from Proposer Day. Any questions that you may have, please submit them through the acquisition, our solutions portal. That's how we're going to be responding to all questions today, and then also during the draft and final solicitation period. And also, I know this is a question that always comes up, but our slides that you see today will be made available and posted to our team webpage. You really should get into the habit of constantly going to our team webpage, as that is going to be a valuable resource. It's where we'll have all links to our draft, our final solicitation. It's where we have links to our requests for solution summaries, which if you're used to working with the government, that's the new name for abstracts. It's just really a great resource that I would check frequently. It's also where you'll find information on teaming, as well as where our Q&A will be posted. Okay, so the first slide, always like to start off with a brief Proposer Day disclaimer. Today we're at Proposers Day, and the goal is to introduce the program goals and vision to the research community. We're here to clarify program objectives and milestones, to encourage and promote networking and teaming, and then to solicit questions and feedback on our solicitation. So since the draft solicitation was posted in early April, up and through when the final is posted, there's going to be a lot of resources that are made available to help clarify the goals and objectives of the program, to include proposal prep instructions. However, and I really want to stress this, only the information and instructions within the program solicitation, that final solicitation that we're working to post, is what counts. Proposals will only be evaluated in accordance with those instructions provided within that final program solicitation. So what is key now is to read the draft. I know that sounds pretty bizarre, but you'll be amazed at how many people don't take the time to actually read the solicitation. I would read the draft, and even though you read the draft, you still have to read the final. We're not anticipating significant changes from the draft to the final, but there won't be that crosswalk. There's not going to be revision markings. So if you read the draft, you can't assume that you don't have to read the final. It's really imperative that you read that solicitation, that you check our Q&A frequently, That's how we will communicate with, that's how you can communicate with the program team, with Jessica, and how we'll communicate responses, especially during this interim period where we have the draft, but the final is not posted. We also may use the Q&A if we realize, we get a really good question. That's something that may lead to a change in the final. We may use that Q&A to kind of tip our hand before that final is posted of, this is a change that we're envisioning. Also, like I just said, please monitor the team page for our Q&A, as that really will help clarify any burning questions you may have, because if you have one, it's likely that that question has already been asked and we've responded to it. So the next slide, we're just going to touch upon kind of the overall basics of our solicitation. BREATHE is a program solicitation, and that is a research and development solicitation. Our research and development solicitation is where the government is defining the problem set, and we're looking for the proposer community to define the solution. So that means we're anticipating a variety of technical solutions to address the problem we're presenting in our solicitation. Proposals are evaluated on individual merit and relevance as they relate to the stated goals and objectives, rather than against one another. So this is a merit-based process, which means we're looking for the best of the best, which may not be the cheapest. And also selections are made to proposers whose proposals are deemed most advantageous to the government, all factors considered, including potential contributions to our research program and based on the availability of funding. And the last thing you'll see in that last bubble, our BREATHE program solicitation is only allowing for one instrument type, which is other transactions. So please do not propose a contract, a grant, or a cooperative agreement, as we're only looking to award other transaction agreements. And I will touch upon what OTs are in the next couple of slides. Again, this is a very high level. Jessica went into significant details about kind of the overall structure of the program. But like I just said, resulting awards will only be other transaction agreements. Other transaction agreements are exactly what I just said. They're anything other than a FAR-based, a federal acquisition regulation contract, grant, cooperative agreement, or a CRADA. We're anticipating multiple awards, and the number of awards will depend on the quality of proposals received and based on availability of funding. So we're really encouraging proposers to propose a realistic, justifiable, comprehensive budget that's supportable for your proposed solution. I point this out because this gets to the heart of one of our evaluation factors, which is cost realism. So basically, we're going to be looking at your technical approach and seeing if your cost kind of aligns with what you've scoped out. The next quadrant you see here, the BREATHE timeline. So please note that some of these dates are already outdated. We're really sprinting here. So when I had to get my slides in, we've already had some changes. But our draft was posted April 12th. We last week posted our request for solution summaries on April 25th. The due date is June 14th for that. So not, oh, it's updated, sorry. The final program solicitation we're looking to have posted in the next couple of weeks. So hopefully by early June. The Q&A process will be open likely through July, so that we have a couple of weeks to get the responses into any of those last minute questions, and then you have enough time with the Q&A to help inform what you put in the proposal. Then proposals will be due in mid-August. Once proposals come in, we'll review them for compliance. Any non-conforming proposals, so those proposals that don't adhere to the guidelines in the program solicitation, will not be reviewed and cannot be selected. So it's really important, again, that you read that solicitation. Then we'll do the scientific review process. And the scientific review process is what I just spoke about that merit-based process, where we're not comparing your proposal against one another. It's really against the stated goals and objectives and in accordance with those evaluation criteria. Then we're looking to release or to send out selection letters by mid-September. And then once those selection notices go out, that's kind of when the negotiation process will start with the agreement officer. And we'll likely have a couple of months, and we're anticipating performance to start in February of 2025. And that's when your performance will start once you have a fully signed, executed agreement signed by both the government and signed by the performer. One important thing to note, we're in the next quadrant, it's just an overview of the technical areas and the program timeline, which Jessica went over already. I just want to kind of drive home the point that all solution summaries and proposals must address all phases, all technical areas. And as you can see, the phase structure is we're going to have a base period of 24 months, and then we're going to have 2 option periods, a phase 2 and a phase 3. Also, just want to note, please do not submit proposals to the draft solicitation. Proposals are only going to be solicited once the final solicitation is posted. Also, please be mindful that you should be submitting your solution summaries following the instructions and the content in that request for solution summary special notice. Again, you can find a link to that on our team page. So next, we're going to talk about what are other transaction agreements. Like I said, other transactions are anything other than a FAR-based contract, grant, or cooperative agreement. ARPA-H has the authority to enter into OTs when it's essential to promoting the success of the project. And as you first heard this morning from Susan, most of what we're doing at ARPA-H, given our mission, given our performer base, is going to fall in that OT bucket. If it's really foundational research, which is really more reports driven, that may be in the cooperative agreement realm, but a lot of what we're going to be doing is falling into the OT bucket. OTs are not subject to the federal acquisition regulation or applicable grant and cooperative agreement regulations, which just means that we have extreme flexibility in negotiating all of those award terms and conditions. So all of the articles that you will see in the OT agreement. It's really a collaborative partnership with industry, and it's meant to mimic commercial-like business practices. There's a lot of flexibility here, and it's really beneficial to kind of the goals and objectives of what we aim to do at ARPA-H. The next slide, just again going over some of the pros versus the cons of OTs. Like I just said, there's a wide latitude in what we can negotiate, and that's because many of the laws and regulations do not apply. It invokes commercial-like business practices, and one of the key things is that we have extreme flexibility and latitude in negotiating intellectual property, which is something that we don't have if we're bound by like the federal acquisition regulations or the assistant regulations. It leads to a streamlined award process. But I say that with a caveat. So that's a little ambiguous because you're negotiating with a clean sheet of paper. How streamlined it is really dependent upon how much and the level of negotiation that has to take place. Some programs, there is extreme negotiation, not extreme, but there is a lot of negotiations that need to take place to really tailor that agreement to fit the needs of both the performer and the government. But what we're really here to do is at ARPA-H is to work with you to really understand your concerns that you're trying to mitigate with some of your revisions to that model OT, and to meet you guys in the middle. The only con that I've really seen with doing OTs is that it's not that familiar for most folks who may be used to working with the government. They're more used to kind of the regulations and the contracts and assistance terms and conditions. So there's a little hesitation because it does involve some sophisticated parties coming to agreement in some of these terms and conditions. It involves working with legal, working with your IP folks. I will say that having everyone kind of involved at day one when we start those negotiations is really essential to driving towards that ultimate goal of that streamlined award process and making sure everyone's kind of in tune of what we're trying to do here. They understand the goals and objectives, which then influence kind of the terms and conditions. So the next slide is just a process overview of what to expect after Proposer Day. So as you can see, we have a solution summary phase. Solution summaries we've solicited for through a special notice that you can find on our webpage. Solution summaries are not required, but they are strongly encouraged. They provide, a synopsis from a tech and budget perspective of what you're proposing. They, again, like I said, should be representative of all phases and technical areas. And the government will review your solution summary submission, and will either give you encourage or discourage feedback, which just means we're encouraging you to submit a full proposal or we're discouraging you. But regardless of that feedback, you can still submit a proposal, and we'll review that proposal irrespective of the feedback. Solution summaries really help minimize you guys preparing a potentially out of scope proposal. So it's really to both of our benefits to get those in and to review them. Make sure that you're submitting your solution summary submission based on the content and guidelines in that special notice. Use the due dates that are stated therein. And there's also template documents to kind of help with the preparation of that proposal. So also, like I noted, the final solicitation will include a model OT, which is representative of the terms and conditions that ARPA-H usually puts in place. It will be tailored for Breathe, but it'll just be that starting point to kind of kick off negotiations once you've received that select letter. So you should review that model OT, provide any comments that you may initially have, and that'll just help speed up kind of once you've been selected that negotiation. Lastly, the government will review all conforming proposal submissions in accordance with the guidelines stated in that final program solicitation, and then selections will be made as outlined in the final program solicitation. The next slides are just the evaluation criteria as stated in the draft solicitation. They're listed in descending order of importance. I'm not going to spend time reading to you what they are. Please make sure you're reading them in the draft solicitation. And if you have any questions, please submit those through the Solutions app portal. And then my last closing slide is just some final guidance of things I want everyone to pay attention to. The final program solicitation will be issued on sam.gov, and we'll have links to that on our team page. If we notice once the final solicitation is posted that we need to make changes that change what's currently in the solicitation, we will issue a formal amendment to get that out to everyone. It'll be posted on SAM with links to our team page. Please make sure you're checking the Q&A frequently. I know I sound like a broken record, but I'm really trying to drive home some key points. Make sure you're paying attention to the eligibility requirements in the solicitation. Use the template documents because, like I said, it'll greatly speed up the review of the proposal. Any of the submissions that are deemed non-conforming can't be a part of the selection evaluation process. So please just, again, make sure you're reading the solicitation. Please visit, I have some QR codes here for our team page, the solutions portal, access to our Q&A portal, and lastly, use the Q&A portal to communicate with us. Don't reach out to Jessica directly or to anyone on the team. That's not the most, it may sound like the most effective way to kind of get your question addressed, but it's not. There are ways that we can communicate with you directly if you have a question that's more specific to your intended approach, but we can do that all through the portal. So we've thought of it all. Please use the portal. And any questions that you may have, we'll work to address later this afternoon. Thank you.
We now have 30 minutes dedicated to Q&A, but to get us launched, I first wanted everybody to introduce, everybody to know a very important part of the Breathe team. So you've met Marissa, and I'd love to, for the folks here to introduce themselves and their role in Breathe.
Hello, everyone. My name is Alexa Copeland-Mendizadeh. I am a systems engineering and technical advisor to Jessica Green. I'm a contractor to ARPA-H. My background is in epidemiological modeling as well as biostatistics. I also have a background in healthy buildings and building architecture. And I have spent most of my career working either at architecture firms as well as EHR and claims companies doing infectious disease modeling.
Good afternoon, everyone. My name is Whitney Beck. I'm also a science engineering and technical advisor contractor to ARPA-H, working with the Breathe program. I've actually spent most of my career working at the Environmental Protection Agency, where I've developed technical tools and also high-profile regulations on tight timelines. I've worked with the EPA STAR Grants program, the Science to Achieve Results Grants program, on air quality, water quality, and climate change grants. And my background is I have a PhD in ecology, a BS in environmental science and policy, and have published on climate change, microbial community modeling, and forecasting.
Hello, everybody. My name is Christopher Smith. I have a PhD in chemistry. Overall, my background's a bit broad between nanotechnology, biosensing, molecular diagnostics, and machine learning. Beyond that, I've also briefly worked in the biopharmaceutical industry in pre-process development, preclinical type of work.
All right, thanks. So for any kind of interactions going forward on Zoom or virtual, these amazing people will likely be involved in those conversations. And so we're going to kick off our Q&A with Marissa.
So as Jessica said, we're going to dive into the Q&A portion. We're going to clarify any of the goals and objectives based on the questions that the community has asked. All of our formal responses will be posted to our team webpage following Proposer Day. But overall, everything we're going to cover based on the questions that we've gotten to date and the ones we're going to answer today are just clarifying what's currently in our solicitation. So there are no deviations. So if you go back to the solicitation, that will further reinforce what we're going to talk about just right now.
Great. Thanks for that intro, Marissa. So the first couple questions we have are actually for you. So we will start with those. The first question we have for you is, can government agencies submit proposals or contribute to a proposal?
So yes, so the prime performer can propose government entities as a sub-performer, but government entities cannot be the prime proposer.
Great. Thanks for that clarification. The next question is whether it's possible to join the project as an international team from areas other than the USA.
So yes, but ARPA-H, with a caveat, will prioritize awards to entities or organizations or individuals that conduct funding work in the United States. But non-US entities may participate to the extent that they are able to participate. And I would reference you back to our eligibility section with our solicitation for further details on this.
Great, thank you. This next question asks, if an existing risk assessment is patent protected, can it still be used in this program?
Yes.
Thank you. is there a specific format for the teaming profile you'd like us to use? Are there templates, and what type of information should be contained within the profile?
So there is a form that is provided to be utilized when you do complete the teaming profile. It'll walk you through what type of information we're looking for.
Great, we appreciate those clarifications. And the next set of questions is for our program manager, Jessica Green. So these questions span a variety of topic areas included within the solicitation. So the first one asks for building and occupant types. So different types can have quite particular requirements for testing one's technology. For example, schools require presenting multiple solutions so they can bid. Hospitals are notoriously difficult to enter. Do you have any thoughts or advice and guidance on dealing with different types of building and occupant types?
So the answer to that is we encourage proposers to select facilities where the final outcomes of the program can be achieved, which again is a 25% reduction in disease prevalence in those facilities at a 10% return on investment. And the return on investment can be calculated as a function of both operational costs and impact by quantifying, as an example, lives saved due to infection prevention or school attendance.
Great, thanks for providing that clarification. The next question is, many of the available controls have major energy use implications, as we heard earlier today. Is energy efficiency an important metric for proposed solutions? Additionally, can climate or carbon costs be included in cost-benefit analysis so as to incentivize low-carbon solutions?
So the answer to the first question is yes. Energy efficiency is an important metric for the proposed solution, and those efficiencies should be quantified in terms of the cost savings of operating those solutions. And yes, climate and carbon costs can be included in the cost benefit analysis to incentivize low carbon solutions. So again, that return on investment, it's going to be a number in the end, but there's many different ways to calculate that return on investment that either have a impact focus based, or again, a return on investment from a pure financial perspective over a short time scale for the user of the technology.
Great. So we started with a couple more technical questions, but the next are more administrative or logistical. May a performer cover all technical areas themselves, or do they need to come in with other organizations as a performer?
The answer to that is if a proposer can complete all technical areas within their own organization, they can do that. Or if there's, an organization that can deliver in 2 technical areas. So the goal is to accomplish what is laid out in the program, and there's many different ways to do that. And if teaming isn't required to do that, then you don't. We're not forcing people to team with or entities to team with others.
Great. Thanks, Jessica. So next is, can ARPA-H provide additional insight into the rationale behind detecting either fungi or allergens? So why the or?
And the reason for the or is, again, we wanted to make sure that these sensors were able to detect 3 broad classes of, I guess I would say, molecules or organisms. So we wanted to make sure they could detect viruses and bacteria. And we're just giving performers flexibility when that 3rd bucket, we could just make it fungi, but we know that some teams may be really focused on immune function, and they may want to be targeting allergens, and that is fine.
Great. So the next question is, does the program seek selectivity in detecting specific types of viruses, bacteria, fungi, and/or allergens? Or is the focus more on general bioaerosol detection? So how are different biological targets defined is an overarching theme of this question. Are distinct viral variants or strange each considered a unique target for purposes of meeting the metrics?
So the answer to this is the teams should really come up with what are the 25 biomarkers, as that is a word that I will use, that are relevant to the application for that team is focused on. And so the answer is yes, we would consider viral variants to be unique targets.
And then does the ability to detect 100 distinct biological targets mean at the same time, or is the expectation that subsets will be used depending on environmental details? For example, season, region, building types, or other factors?
It means at the same time. It's a highly multiplexed solution where at the same time you get an answer for 100 different targets.
Are there particular sensor approaches that are favored or disfavored for this program?
The answer to this is really long, but what I'm going to say is this is all outlined in the solicitation, and sensors that get the job done, which again, if it's capable of a highly multiplexed, autonomous monitoring of the indoor environment, where it's possible then to have the outcomes at the end of the program that we've been talking about all day. We're really looking forward to seeing the innovative ways that teams want to address that. What is out of scope of this program are solutions that are only using proxies for biological detection. So I can imagine a world where proxy measurements are coupled with the development of these biosensors so that we can learn how well these proxy measurements provide information, but proxy sensors alone are out of scope of this program.
Great, thank you. Have another question about sensors, and this one asks, are you looking for continuous real-time sensors, or is it okay to have periodic sampling of the airflow in the duct system, for example, which could be done on-site via rapid detection and or off-site for more sensitive detection and result confirmation?
That's the first time I'm seeing this question. And what I would answer is that the cadence of the sensors being able to detect what's airborne is really going to be determined by the performing teams that will be modeling and assessing how frequently do we need to be gathering information. So what's the temporal cadence, and also where do we need to be getting information so that we can assess risk of the occupants, and so that there's actionable information where then an intervention can be triggered that will impact the health of the occupants in the building.
Great, thank you. So I think that partially addresses the next multi-part question we have listed here. But one component that I don't think was answered was if you could please explain the rationale behind setting a 45-minute detection window, particularly in terms of its cost-benefit analysis.
So the answer to that question, I think we need to really carefully answer that, and I think we should put that in our written Q&A, because that's a highly technical question.
Great, thank you. And that's a good plug that, we're answering these questions here right now, but there will, as you have heard many, many times today, ultimately be a written Q&A that's available on the program page. It'll include these questions and additional questions as well as they're coming in.
I think one thing I would say is that if teams come up with capabilities where it's possible to have a 25-plex sensor that is autonomous and cost-effective and that has a turnaround time of less than 45 minutes, that would be amazing. So it's highly encouraged. I think we were thinking of all of the different factors and all of the constraints and requirements of this program in its totality. And we did our best to come up with metrics that we thought were moonshot and technically feasible at the same time.
Thank you. So the next question asks if you can clarify if the chamber testing in phase 2 requires the use of a prototype device or merely the same assay technology described as biosensor technology in the proposal, and whether all 3 manufactured prototypes tested for biosensor performance reproducibility need to be identical. Or if different prototypes that ensure reproducible performance are acceptable.
So the spirit of the chamber testing in phase 2, so I think we described in phase 1, we're envisioning a more manual process of assessing the efficacy of the prototypes and validating that the prototypes are on track and they're working before spending the money on the chamber testing. For the chamber testing, we definitely want, yes, the purpose of that is to test and validate the prototypes before they go out into the wild and go into the selected facilities. The second question is whether or not, and I thought this was a really creative question, and that's why, again, when Carl Bass was kind of saying the value of having a dialogue, this question made me think more creatively, I think, than I had been prior. So the question is, basically, can we come up with like different prototypes in our team and then test those in these chamber studies? And the answer to that is yes. I think that if your team has ideas and you want to kind of be moving through the pipeline more than one model of a biosensor, I think you should pitch that because that makes a lot of sense to me. What I don't think is a good idea is to just have one prototype of each different type and then we're only validating one prototype in the chamber studies. I think we should have some replication of testing prototypes in the chamber studies. So we would need to figure out a way to be, running more than like 3 of the same prototype in the chamber study.
Thank you very much. So can existing technologies, such as commercially available multi-sensor IEQ management systems, be modified to detect airborne biological threats, or must it be a standalone system?
So the answer to the question is yes, existing technologies such as commercially available multi-sensor IEQ management systems can be modified. So again, we want performers to come to the table with ideas on what is kind of the most effective way to advance this field. And I can imagine a world where if there's already an existing platform that is measuring for, again, CO2 or particulate matter or other air quality metrics, and there's already kind of software that's associated with that, then layering on top of or integrating with that system the ability to monitor and assess the risk of bioaerosols, I think that's fine. No reason to start from scratch if it's not required.
Thank you. So our next few questions are about buildings included within the studies. So according to this question, proposers are encouraged but not required to use control buildings with matched populations while ensuring statistical validity in their experimental designs. Could you explain how statistical validity can be achieved without the use of control buildings, given that this approach could potentially lead to ambiguous interpretations of the findings?
So the answer is, I can't imagine a way that this is going to be done without control buildings, but I'm not the expert. The performers are the experts. So I don't want to constrain the thinking of performers or kind of dictate the way that performers are going to approach these problems. So if performers come up with a way to achieve the overarching goals of Breathe without using control buildings, I'd love to hear it if they think that that's the most effective way to move forward. Or we would love to hear it.
Thank you. The next question asks, does the scope of the study include residential facilities like single-family homes, university residence halls,
public housing, and apartment complexes?
So the answer is yes. The proposers can choose really any building type that they want to work in, but again, the building type selected should allow for statistically linking exposure incidents to or within building exposure to health outcomes.
Thank you. And on that note, how many building types are required? As the solicitation mentions both multiple and single building types and when they are to be selected. Or when are buildings to be selected?
One building type. So we want performers to select whether or not they're going to be working in homes or hospitals or schools, as an example. And then in addition to that, we want during the efficacy studies to be in 3 different climate zones, those buildings. And there may be a world where there's just 3 buildings total, 1 building in each city. However, it's really going to be up to the performers to demonstrate that they're going to have enough statistical power for whatever sampling design framework they propose. So I would imagine that performers, might choose to be deploying these systems in more than 1 building per city. But there could be ways, if it's an enormous building or something, there could be ways to kind of tackle the overarching goals of breathe. There's many ways to slice and dice it.
Great, thank you. I'm going to skip over this next one because it quotes some very specific language from the proposal and will probably be easier to read than talk about out loud right now. So the next question asks, are chamber studies, human studies in quarantines with controlled chambers within scope? For example, an environmental chamber with highly controlled ventilation to simulate a dormitory or healthcare 4-person bedroom or hotel quarantine study?
So the answer to that is what is a requirement is to collect baseline data in real world environments and to then deploy, breathe, and invented systems in these environments. And it is also a requirement to link occupant outcomes in those facilities with what occupants are being exposed to. Now, if proposers do not feel that they can adequately assess risk using public, data that's already been published from human challenge studies as an example, and make a case that in addition to what's been, laid out as a requirement, some funding needs to go towards human studies in a quarantine environment. Again, we want to be open to hearing what do performers really feel like the data that is required to solve the larger scale challenge of what's been outlined in the program. But then that funding then would take away from funding for doing other things in the program.
Thank you.
Mm-hmm.
We have 4 minutes and just 3 questions left, and then we will get you to the poster session. The next one is, are Breathe program performers required to measure both the incidence and point prevalence of respiratory illnesses over specified periods using technologies capable of distinguishing RIs caused by indoor bioaerosols from those caused by non-biological stressors?
Okay, so I think what this question is asking is, does the program require trying to tease apart the health consequences of bioaerosols versus other elements of the built environment, which again could be particulate matter, CO2, or other aspects? I think that would be fantastic if proposers are able to do that, because ultimately, in the long term, we're going to want to have something like this indoor air quality index that spans biology, chemistry, and physics, and the costs of deploying air chemistry and particulate matter sensing isn't extraordinary. So I would encourage performers to capture that type of metadata and then to try to assess the relative contribution for the health impacts. But it's not a requirement of the program.
Great, thank you. In order for proposals to demonstrate the effectiveness of their solutions at lowering the prevalence and/or incidence of respiratory incidents in the study buildings, may Breathe performers employ off-the-shelf or minimally modified commercially available technologies?
Yes.
Fantastic. Last question has some insight. We don't understand how people think about indoor air and the technologies we will use. And so on that note is a science communication, outreach, and community engagement research component within scope to get the users to care about air and demand the technologies this program enables.
That's good. You can go.
Yeah. So ARPA-H is going to be responsible for that outreach and will provide guidance to performers on how to message about the Breathe program. There'll be certain stipulations within the agreements about what can be publicly made available. All of that will kind of, those guidelines will be included in the agreement, but you do not need to include community engagement or research or something similar within the proposal back to us.
It's kind of amazing. We did that and we have 1 minute left. All right. So now we're going to wrap up the Q&A and we have an hour for poster session and networking. And then at 3 o'clock, the sidebars start. Thank you.